That was a gem of video, yes. We will, I smell an RWIP grant to do something in Manitoba with something cooler, but that was pretty good. Let's see, do we take the full 5 minutes or we get going already? Let's see. Tiffany, shall we? I mean, that was, I don't know how long that video was, a couple of minutes. I don't have a watch. Are we good? Sure, let's start. I'll do a little bio, so as people kind of come back in, we'll go from there. All right, so hold on. I got my little prop here. I got my little OCAL, Occupational Health Clinics for Ontario Workers. And you know, that they went from that stress ball to the thing you take and you throw at the wall. But watch the repetitive strain injury of the pitcher's arm here. We're starting baseball soon. I got my Zoom meetings all set up for the players to do their stretching and conditioning in March so that we can have tryouts in April outdoors. So thank you, OCAL, for when you came for a visit. I got my stress ball. All right, so we are now going to have a speaker, John Oudyk, who is an occupational hygienist from the Occupational Health Clinics for Ontario Workers. And he'll be talking about measuring psychosocial factors in the workplace using the StressAssess online tool. And it's something that not so much myself, but our staff here have been working a little bit with Ontario on the CSA standard, and they came across some great resources. And so I said, hey, he's from Waterloo. He has a degree from Waterloo too, so I'm picking John as well. All right, so since 1989, John Oudyk has been an occupational hygienist with the Hamilton Clinic. By the way, OCAL has clinics all over Ontario, including my hometown of Sudbury. John graduated from chemical engineering at the University of Waterloo in 1983 and McMaster University Health Research Methods Program in 2005. He is an assistant professor part-time at McMaster University in the Department of Health Research Methods, Evidence and Impact. And he is certified both with the Canadian Registered Board of Occupational Hygienists and the American Board of Industrial Hygiene. So thank you, John, and off we go.
Okay, thank you. Let me set this up here. Okay, I hope you're seeing the right screen. Let me know if you're not. Thanks for the opportunity, and it's great to be participating with our sister clinic. Okay, I think Dwayne set it up real nicely, and there's very little I can add to that, but if I would have known his slides, I would have left out a few. But mental health is a big discussion, and mental health at work is also. And here are some of the organizations that are leading the public discussion on this issue. The cost of work-related mental health has also been a big topic of concern. Way back when, there was an estimate that the cost of the mental health burden to the Canadian economy is about $51 billion. And Martin Shane back in 2008 estimated that 10 to 25% of that burden is work-related. And so $3 to $11 billion of the costs could probably be prevented by changes in the workplace. And I think most employers probably don't see that. They might see some of it in the sickness and accident costs, but generally it's probably been thought to be part of the cost of doing business. The CSA standard Z1000, the Occupational Health and Safety Management Standard, recognizes 6 areas of hazards, and psychosocial hazards are part of that. And Dwayne already mentioned the psychological health and safety in the workplace standard. We had some connections with people on there, and we found that during the deliberations, they actually replaced all the instances of the word psychosocial with the word psychological. And the that really sparked a thought in my mind about what the words mean. And they actually reflect differing perspectives. We have psychology, which focuses on what's going on between your ears. And it really focuses on the individual. It's been called responsibilization as a term. The psychosocial is a little more broad. It looks at not only what's going on in your head, but everybody else's head and how the environment affects the interaction of all those heads in the workplace. So I also want to introduce this prevention framework, this primary, secondary, and tertiary prevention. And for those of you familiar with health and safety, it's somewhat analogous to at the source, along the path, and at the worker. At the individual level, tertiary prevention is helping those who have problems with therapy, counseling, medication, and support. Secondary prevention is about wellness, relaxation techniques. Mindfulness is an example of that. Primary prevention is building resiliency through coping and appraisal skills. However, there's also an organizational dimension to this. So there's different intervention levels. There's employee or family assistance programs, recognition of chronic stress by the compensation boards, return to work programs. There's awareness, such as mental health first aid programs. But there's also primary prevention at the source for the organizational level, and that's changing the culture, the climate, the work structure in the organization. And when we do assessments of organizations, we find that this is the box that is most often not being engaged in. We can also expand this beyond the individual and organizational level. We have the group level, the department, shift, or team. And it's the same as the organizational, but it's operationalized. The organization may have policies and procedures, but they're operationalized at the group level. And you can have excellent policies, but at the group level, if they're not operationalized well, then they may not benefit. The reverse is also true. A group may be very strong and cohesive and help each other, regardless of a lack of policy and direction from the organization. There's also economic sectors. Certain psychosocial factors are more predominant in various sectors or express themselves in different ways. And at the societal level, the CSA standard is an example of that. So I got involved in this in doing indoor air quality work in the 1990s, where we asked about stress, and with the firefighters in 1997 after a big fire in Hamilton. But the mental injury tool group, which is a particular group established in 2009, started out trying to help worker representatives take action on prevention and compensation issues. When this committee met, they figured that mental injuries was the area of greatest need. And so that's the area they picked. And it's been about 12 years since we've been at this. So the question they dealt with was, how do you go about doing a psychosocial risk assessment in a workplace? Well, they've been doing it in the EU for many years. They've had legislation on the books as far back as 1993. A lot of it was token, and it was only people paid lip service to it. So in the last 5-10 years, many countries have been requiring quantitative measurement of psychosocial hazards. And so there's been a boom in the business of doing surveys, cost about 10 euros a piece. And in 2012, there was an enforcement blitz amongst these countries, and they all focused on looking at the workplace psychosocial risk assessments. So we learned from them, and we took up the Copenhagen Psychosocial Questionnaire. And it's been recently revised to COPSOQ 3. And this is what the core survey contains: 3 elements in work demands: quantitative, work pace, emotional demands, work organization factors such as influence, possibilities for development, meaning of work, and commitment to the workplace, which is similar to engagement. Work relationships, about communication, predictability, recognition, role clarity, role conflicts, leadership, supervisor or colleague support. Workplace values, vertical trust, and justice and respect. In Europe, that's often referred to as social capital. Various employment factors and some offensive behaviors. Now, when we piloted this tool, people were telling us you're missing certain things. For instance, I work shift work. There's no question on shift work or other things. So we added many other factors, including health and safety concerns. We also looked to the COPSOQ for some health and symptom questions, added additional offensive behavior questions, and questions on culture and climate. So here are the 13 CSA factors and the various COPSOQ factors and the ones that we added. And I tried to map them. It's very hard to do because these subjects are very fuzzy, and there's a couple of them that don't even map very well. So we have actually more factors than the 13, but they do line up. So what do we compare our survey results with? Well, back in 2016 and again in 2019, we contracted ECOS, a polling company, and they polled Canadians, employed Canadians in workplaces with more than 5 people. And we had over 4,000 respondents, both in English and French, and they provided weighting factors to adjust to the monthly StatsCan labor force survey so we could try to estimate a representative population of Canadian workers. And one of Dwayne's colleagues, Peter Smith, helped us out immensely with this in doing the statistics and analyzing the data. And this article has been published, and we paid a lot of money to make it open access. So please click on the link when you get the copy of the slides. We also put together a number of tools on our website. It's a 93-page guide, the survey, videos, posters, etc. There's an old app which is called Measure Workplace Stress, and there's some new apps which are called StressAssess. We have an old webinar that's still available online, and our online survey administration web app, and that's what I'll be focusing on. So this is what the welcome page looks like. Welcome to StressAssess. And you get to choose from 2 versions. The personal edition is more for education. It's a short form with just the COPSOQ questions, not the additional ones that the MIT group added. And it's we don't collect the data unless you want to donate it, but we don't do much with that. It was more for education purposes. What we're really interested in is the workplace edition. And what this allows you to do is create an account where you can create surveys and circulate a link to your colleagues at work. And once you close the survey, you actually get a report. And this is what we asked you to do, is to fill out the survey. And as of this morning at 5 o'clock our time, 4 o'clock your time, there were 95 completed surveys, and this is the dashboard, so you can keep track of how the responses are going. It's confidential, so you can't see anybody's individual results. For some reason, the programmer also put a little box that you can tick, and you can see a word cloud of the comments that were given to date. Here's the frequency of some of the economic sectors of the people who responded. You can see over a quarter of them are from healthcare and social assistance. Education and public administration are about 10% each. And then we have some from transportation, construction, manufacturing, finance, technical services, and unable to find the right classification. So then we have overall ratings. We have 2 global questions. One, how would you rate the psychosocial health and safety climate at your workplace. And you have a range from healthy and supportive, good, fair, neutral, not so good, poor, and toxic. And this is your results of the people who responded. And your results are remarkably similar to the Canadian average. So then there's also the organizational culture tolerates behaviors harmful to mental health. And again, you're fairly similar. You can see that quite a proportion of respondents felt that their organization tolerated behaviors that are harmful to mental health. This is the various Copenhagen psychosocial factors, and they're in groups. Work demands is quantitative, work pace, and emotional demands. And here your quantitative demands are not as good. That means you have more quantitative demands than the typical Canadian who responded to our cross Canada survey, but your work pace is better, which means slower. And the only other one that was different was you were better off on less role conflicts. But for all the other ones, you're about the same as a typical workplace, Canadian workplace. However, remember the $51 billion and the $3 to $12 billion that is work related. The typical Canadian workplace has its issues, and just being the same as average does not necessarily mean you're well off on these issues. Now, for each of those scales, you can have a detailed breakdown of how people responded. And some of them, you can see some interesting information here that you don't see in the previous slide, because, for instance, emotional demands, the average is pretty well typical of Canadian workplaces, but what we see here is a bimodal distribution. We have 30% of the respondents who are much better than the Canadian average, but we have 35% of the respondents who are much worse, and we have just a few in between. And so this sometimes helps dig down deeper into some of the questions to see things that you won't see in the overalls average. These are the health and safety and workplace environment questions. And here ergonomics is number one. That fits nicely with the topic of today. And it's followed by thermal comfort and driving hazards, air quality and biological hazards and physical factors are also fairly important here. And we scale them in these are exposures that cause concerns, annoyance, or actually interfere with getting the job done. And then we have word clouds for the top three. For instance, for ergonomics, it's about design issues and static increased. For the thermal comfort, looks like things are cold. Yeah. And then for the driving hazards, weather conditions, parking lots, things like that. Now, comparing to the Canadian average is one way to look at your data, but you can also look at it internally. So what this is a correlation matrix where we have all the risk factors, all the exposures like work demands, work organization, relationships, job insecurity, and social capital down this column. And along the top, we have burnout symptoms, stress symptoms, sleep troubles, somatic symptoms, cognitive symptoms, and then we add all these 5 up to all symptoms. So if you look at this last column, it's kind of a summary of what's going on. And the darker the color, the stronger the association. So you can see that for all symptoms, they're not related at all to influence at work or possibilities for development, but they're more strongly associated with recognition, role clarity, and role conflicts, and job insecurity. So what we do is we collect the top factors and we list those, and recognition. These weren't shown on there, but they're also factors: accommodation for outside responsibilities, job insecurity, physical factors, lighting and noise, and role conflicts. Now, if you want to pick a positive outcome instead of symptoms, you can do that too. So for job satisfaction, interesting, recognition was #1 for both. So if you lack recognition, there's a correlation with more symptoms. If you do have correlation, recognition, there's a good correlation with job satisfaction. So it's an interesting back and forth. I also broke it down into the numerical values. This is not provided on the website, but I thought I would do this for you. Here are the comparison numbers. So for quantitative work demands, 45 is what the average Canadian worker scored. And for RSI Day participants, the average score was 51. Anything 5 or more is considered quote unquote clinically significant. 3 or more is just borderline. So you can see by the colors which ones are good and bad. And you can see that role conflicts is quite a bit lower. And then I also broke them down according to gender identity. And we have men and women identities reported here. Emotional demands is much higher for people identifying as women than men. For the rest, it's relatively the same. However, when we look at age categories, here we're getting into some small numbers, so you need to be careful. But for I see this pattern in other surveys too, that young people are struggling in the workplace quite a bit more. And then we often have this 60 plus doing extremely well. And I think some of this is that the people in 60 plus are either in the workplace because they choose to be, or they're often independent and can have a lot of choice over what they do and how they do things because they don't have to be. Sometimes the people approaching retirement are having a much harder time. And also the 30 to 39, where you expect people to be raising families, and they often have higher reports of demands and symptoms. And here we have some of the individual work interface factors, the social capital, the health and well-being, the symptoms, and also the offensive behaviors. You can see, for instance, for sexual harassments, those identifying as women had 6.8%, whereas none of the men respondents reported this. When we look at age distribution, again, you see a lot of red in the young column and a lot of green in the oldest column. Also, you see the symptoms associated with the 30 to 39. If you look at sexual harassment, you can see a gradual dose-response relationship, quote unquote, with age, or with age, the youngest having the most and the oldest having none. And you can see different patterns here. Now, the way we apply this in the workplace is, well, we struggled with it for a while, and we finally landed on this continuous improvement circle where we have 5 stages: learn, organize, getting your ducks in a row, assessing, doing the measurement, making the change, evaluating the change. And once you evaluate it, you learn something new and you can start the circle over again. So getting started, it's important not to jump into the survey right away, but to familiarize yourself with the basic, deepen your understanding, and also share your awareness with others and identify resources that you'll need when you go forward. And organizations are often can be classed in this different stages or focuses or perspectives. The early stage is when they're just looking at regulatory compliance, so violence and harassment legislation, that type of thing. Awareness, here we're looking at what role can the workplace play in supporting people with mental health issues, reducing stigma, increasing the conversation. It's all about individuals and changing attitudes. However, the next stage is where the workplace actually realizes that they also impact the individual's mental health, and that they can do something about it. They can measure it, they can manage it. And in Nordic countries, they actually see this as a way of an opportunity to innovate and optimize the organization to make it better. They don't see it as a risk assessment, they see it as an opportunity for growth. Then we have the organized. In a workplace, and one individual cannot solve everybody else's stress problem. In fact, if they try, they'll probably make it worse. So you need to get some respected and representative people together in a committee to lead it. You have to take into consideration how ready the organization is for change. And if it's not ready yet, you need to raise awareness and commitment to the process. So the stages of change, I think you've probably seen these, but I thought I'd apply them to organizations instead of individuals. So there's the not ready stage. They're in denial, or they just think, well, this is part of the work. Then there's the contemplation stage where they think, well, maybe things could be better, but I'm not ready to do anything about it yet. And then the next stage is when they're thinking and ready, and it's time for action. However, once you start action, you need to maintain it. So this is not something like health and safety where you fix a problem and walk away and wiping your hands. This is something you have to stay at. And the minute you let it go is when it starts slipping away again. So then you're ready for an assessment once you've got that support and you've got that knowledge under your belt, and you can select the tools. Surveys are one of them, but there are other tools available, and you need to think about how you're going to respond to the results, because the results are often automated like ours. And therefore, as soon as you close the survey, you have the results, and then people are expecting you to respond. So think about the response before you do the assessment. Finding solutions to your problems. One thing we recommend is holding a kind of focus group to report back your findings and brainstorm. Uh, Also, selecting which factor to work on. Do you want to look at the top issue, which sometimes can be the most difficult one, or do you want to look at a lower one that's easier to deal with? Look at your resources, and again, don't work alone. And it's a conversation. Here is a resource from the International Labor Organization. It's called Stress Prevention at Work Checkpoints, and it's divided into a number of checkpoints dealing with specific hazards. Workload, quantitative demands, it gives us suggestions on how to deal with it. The booklet is actually quite bureaucratic, and organizations that have tried it have really gotten bogged down in the bureaucratic part of it. So I use it as more of a book to get ideas. For instance, I like number 2 here: reduce unnecessary tasks such as control operations, writing reports, filling in forms, or registration work. And here's something from a different tool, a hospital guidance tool, about emotional demands. And here's a simple one, the bottom there: possibility of withdrawing, a place of privacy, especially in healthcare, social services, or education. You might have an emotional crisis that you have to deal with. And if you can just chill out someplace by yourself for a few minutes to collect yourself before you have to face the next problem, it's a simple thing that although implementing it may be a little more complicated in some workplaces. But our suggested response plan is, first of all, to present the results and get people to give them time to digest it, because it's quite a lot of information. We often suggest writing up a 1-page summary for circulation. Start focus groups where you brainstorm their reactions and there's possible solutions to the problem. We have ideas that are provided in the report. They're generic, they're not specific, but look at them as kind of seed ideas, and hopefully others will grow out of them. And then offering a way of getting anonymous suggestions. Sometimes people feel too shy or vulnerable in these focus groups to contribute, and so you need another way of contributing. So the committee would then collect all these recommendations and ideas and work them into specific suggestions for the employer. And there are resources along the way. In Ontario, we can help workplaces. We have worked with some workplaces outside of Ontario too, but don't tell anyone. And finally, once the recommendations are implemented, wait for a period. We generally recommend 1 to 2 years before assessing again. So once you make the change and evaluate it, then you're back to the start again, learning about what you've done so far and how it's improving or not. So we've done this survey in approximately 150 workplaces and done 2 cross-Canada polls. We've been at it for quite a while. Some workplaces are on their 3rd survey. And that's not all counting those who use StressAssess and don't let us know about it or get us involved. So our experience is that this tool works the best in workplaces that are good at problem solving. They can do anything. So when they tackle psychosocial factors, they're usually successful at that too. However, it also works well in the worst workplaces, the toxic workplaces, because these places are in a crisis mode. Something has to be done before things will get fixed. And so it's a nice way of objectifying the problem and depersonalizing it. It also gives you a vocabulary of terms to use, and we often find that we get good response rate. Where it works the least is where people aren't really that committed to it. They're doing it more out of curiosity. They're not really, they don't realize what they're getting themselves into, that type of thing. And there we look at it as a bit of a education process, and you got to make a few mistakes before you figure out what you're doing in this. And so that's my 29 minutes, and I'll leave it at there. Of any questions or comments?
Jennifer, Mike, are there comments for John?
Yes, there are. There's just two kind of questions here. So is the survey available to send to others in the workplaces, in different workplaces?
The way that it works, if you set up an account, you can create your own survey, and you can create more than one. So if you want to do one department at a time, you can do it that way. If you have multiple workplaces, you can set them up differently. You can also do them all at the same time by identifying departments. However, it doesn't give a separate breakdown for the departments, so we would recommend you create multiple links for one for each group.
Great, thank you, John. The second question was, I'm not sure if you can comment on how this assessment tool might differ from the Guarding Minds at Work survey.
Yes, I can comment on that. We actually did quite a study. Our tool, as I mentioned, we did confirmatory factor analysis to confirm that the scales that we're using are actually valid scales. The Guarding Minds at Work people have tried to do that too for the 13 factors. And the last report I saw of it, they came up with 4 factors. So they haven't been able to confirm that. Also, the Guarding Minds at Work was set up for employers, specifically by an insurance company who was trying to reduce the sickness and accident costs due to absences due to stress leaves and that type of thing. So it's a tool that's designed for employers. Ours was more designed by labor representatives and academics who were interested in our project working together. The tool itself from the Copenhagen Psychosocial Questionnaire has the background of a lot of researchers in psychosocial factors from Europe, especially Denmark, Sweden, Germany, Spain. We're a part of a network that support this, and there's I think it's translated in at least 26 languages now, and it's used all over the world.
Great, thank you for that answer. And then the last question, the final question that came in is, have you noticed any significant changes in responses since COVID? So since the pandemic, any changes in the responses?
Yes, we have done some surveys where we did surveys before the pandemic and then during the pandemic. And it differs in different workplaces, obviously, but for people working at home, sometimes we find that some of the offensive behaviors go down because there isn't personal interaction. And the exception to that might be bullying, whereas you can do bullying or incivility through Zoom by tuning people out and things like that, and being curt, etc. We have found that depending on the workplace, the quantitative work demands can either go up or down. They go down when people have less interruptions to their work and things like that, and they can be more efficient. They can go up when they don't have the structure of hours and they find that they're working continually. So it's a mixed bag, but definitely we did do 3 surveys now for pandemic, one for healthcare workers, one for non-healthcare workers, and one for educational workers. We've published 2 papers on that. If I have time, I have a few extra slides that I thought, since the question might come up, I could show you quickly. But yes, we have been looking at it quite a lot.
Great, thank you. No, thank you so much. That was all the questions that were in the chat for you.
Did you want me to show you the extra slides or not?
I'll leave that to Andrew.
Yeah, we have a minute. So while you're getting that slide up, I'll ask you my question. Have you used this at Rideau Hall lately?
No, but we should have.
All right. So yes, we have a minute before our next break for a slide or two.
Okay. For instance, here are some of the factors that we use in COPSOQ. And on the right-hand side, you see the comparison. And so, for instance, burnout symptoms, 50 was in 2019 in our survey. Healthcare is 66. Remember that anything more than 5 is a significant increase. Non-healthcare was also higher. Sleep symptoms. We have work pace for healthcare workers, predictability, communication, the information you need to do your job, way down. Supervisor support down, colleague support up, which is interesting. And then we also looked at anxiety symptoms, and for healthcare workers, over half screen positive. This is for clinical. This would, if they were in an office, they would be followed up for a clinical diagnosis of anxiety disorder, and for general workers, it was 41%. And we found that it was related to whether or not people's personal protective equipment or infection control procedures and practices were met or not. And for non-healthcare workers, we saw that even if all your needs were met at work for infection control practices, you had less anxiety than if you were working at home. So we thought that was quite interesting and surprising to us. And these are the 2 papers that we published on that. And we're doing another survey right now, so you can participate if you're interested. Thanks. Thanks for letting
Wonderful.
me squeeze that in.
Yes, no, always leave them wanting more, as the expression goes, eh, John?
Yep.
So I was just thinking, what a great benefit to having these virtual meetings is now what? It's recorded. You can go back and slow it down and take notes. As I'm making my own notes, I'm going, why am I doing this? Sit back and enjoy the show. So thank you, John. Great information. And for your gift, I'm prepared to send you 6 dozen frozen pierogies.
Okay.
All right. And if I like you, I'll throw in some petishkia. If you know what that is, I'll send that in too.
Okay.
Okay. All right. So
Thank you.
let's go on to our next break. And we'll see you in about 5 more minutes. So get up and walk around, everyone, please. Thank you.